Welcome back, everybody. Dr. Alex Spinoso, and today we're going to talk about plantar fasciitis and the easy and free way that you can treat it that isn't actually in any of the textbooks nowadays. So, plantar fasciitis is one of the most common causes of foot and heel pain in the nation. There's roughly 1 million visits to the ER as well as to urgent cares and primary care doctors a year for people suffering from plantar fasciitis. First off, plantar fasciitis, what is it? Well, what it is inflammation of this thick band of tissue that runs across the bottom of your foot and connects the heel bone to your toes. That tissue is actually called the plantar fascia. And if you think about fascia, fascia covers all of our muscles. What it is kind of a saran wrap for the muscles, and every single muscle in your body actually has fascia. How do doctors diagnose plantar fasciitis? Well, most of the time it's actually from just your history. If you're having pain right out of bed with walking, those first couple steps feel like lightning or a searing pain in the bottom of the foot, our physical exam, and that's about it. There's no images or anything necessary, no x-rays, no MRIs, nothing is actually necessary to diagnose plantar fasciitis. This is a foot we have here. Thanks, wife. So the plantar fascia attaches here at the heel and spreads out to all the toes in almost a triangle type formation. Plantar fasciitis pain is going to be greatest here. So if I see somebody who's having foot pain and I ask them in the morning if they're having foot pain, is it worse? Does it get better throughout the day? And if I push right here, if they jump or want to kick me, that is the diagnosis of plantar fasciitis. You don't need any fancy tests in order to diagnose it. So treating it, why is it important that we treat it? Well, if you don't treat your plantar fasciitis properly, it can lead to more inflammation of the plantar fascia and actually micro tears of that fascia off the heel. Now, once the micro tears start to happen, not only are you going to have increased amount of pain, but you'll also have more weakness of the foot, and that can lead to severe irreparable damages of the bottom of the foot. How do we treat it? Most of the time, what doctors are going to tell you is, bind your feet in some sort of shoe that's more supportive, use supportive insoles, take rest off of your feet, take some pain medication, do some rolling of the bottom of the foot as well as massages and stretching out. Now, most of that is true, but none of it is going to actually treat the problem. So what's the main problem that causes plantar fasciitis? The problem is not only stress, but muscle weakness. If you think about it this way, your feet have just as much muscles as your hands. But we use our hands every day. We grab things, we're moving things, we're talking with our hands. If you're Italian like me, you're constantly using your hands for different work. So treating plantar fasciitis should focus around strengthening the foot muscles. Once you strengthen the foot muscles, everything should go away. This theory actually holds true in trials. I performed a trial with multiple patients at a facility I used to work for. And what we did is we taught patients something called the foot grip exercise. And what that is a strengthening exercise for the bottom of the feet. Now I'm going to show you a short video of how to do the foot grip exercise. So now I'm going to show you how to do the foot grip exercise. What I have here is a simple kitchen towel or any type of towel. You can also use a t-shirt, anything that slides easily. You can also do this in socks inside your shoes all day long. And what I'm going to do is I'm going to spread the toes as high as I can. Spread them, spread them, spread them. And then I'm going to squeeze the towel. Spread them, squeeze the towel. Now, it doesn't have to be spread or squeezed for a certain amount of time. That's not the big deal. The main issue is that when you're squeezing your foot, you try and squeeze your toes as hard as you can. And what that does is it flexes the plantar muscles of the feet. So that's it. That's how you treat plantar fasciitis. In the study, having the patients do this 100 to 200 times a day completely eliminated their plantar fasciitis in 90% of patients. The other things that can help out with plantar fasciitis are stretching every day, and you can look up plantar fasciitis stretches on Google. The other thing you can do is use a tennis ball or a racquetball or a can of peas or something like that and put it under your foot and roll it back and forth across the plantar fascia. What that's going to do is allow the plantar fascia to stretch out a lot more. The more stretches you do, the more strengthening you do of the muscles of the bottom of the feet, the less your plantar fascia is going to bother you, and you're going to cure it within a few months of doing these exercises. So I hope this helps a lot of people. I hope you enjoy watching. If you did, subscribe below. DM me or message me any comments that you want to get off your chest, or if you have any questions, please let me know. I appreciate you watching. See you next week.